welcome back to my channel. I had a couple of minutes to spare, so I thought I'd jump on here and talk about home birth versus hospital birth. I'm gonna be looking down a little bit because I have my notes, because I'm a note taker. Okay, I'm just gonna stop. I'm wearing this shawl because it's really cold in here, but I don't feel like starting the wood stove because it's May 1st. Yeah, we're just not gonna talk about the weather because it's a little depressing. So, I guess kind of like I first wanted to start out with saying that all of this is personal preference. Like if you wanna go and have a home birth and you're able to, go and have a home birth. If you wanna go and have a hospital birth and you're able to, go and have a hospital birth, as long as you feel comfortable, supported, and like you made the right decision. If you're sort of like, I don't know, let's just get into the video. Okay, so first thing, let's start with the home birth, and we're gonna start with the pros because everybody likes the good stuff first. You're able to deliver in the comfort of your own house or someone else's house. I don't know, maybe your house isn't ideal for a home birth and maybe you want to deliver in your mom's house. Living in your own home can cause this huge relaxation to happen because everybody feels more relaxed in their own home. Another kind of bullet for the home birth thing is there's no restriction on who can be there, how many people can be there. So you can have a group of people there as sort of like your massive support team, or you could just have a couple, like 1 or 2 people besides your midwife, obviously, at the birth. You really don't have a restriction with that. A lot of hospitals, sometimes it's like only 2 people, 1 person. Yeah, we could go into that forever, but with the home birth, there's usually no restriction on that. You're also allowed to eat and drink pretty much as you'd like. There's usually very little intervention. I mean, your midwife is there to kind of protect that part of like not too much intervention. Obviously, if there's a complication or that's needed, she will and should, you know, make sure that those things come into play. This is kind of like a weird one. I always feel like choosing your own delivery position, yeah, you might be restricted at a hospital. Don't go to that hospital if you're restricted on that. Like, why? Definitely at a home birth, you shouldn't be restricted at all. I mean, you can deliver like standing up, squatting, laying down. I wouldn't advise laying down, but I did that with my first one almost. I was like literally laying down, just like not moving. And my midwife was like, usually that's really painful. But it was kind of a funny thing now. But usually you can deliver in any position that you like. Another awesome thing that I loved having was you could go to sleep in your own bed. You can wear whatever you want. You can soil like your husband's t-shirt and then you put it in the wash or throw it out. You don't have to wear one of those disgusting smock things that somebody died in and then they just bleached it really good. I mean, no judgment, but come on, those are gross. You also have the option, which I think is really nice, you have that option of the follow-up. So that means baby's out, everything's fine, midwife leaves, the next day midwife comes to assess everything, making sure breastfeeding is going well, baby looks good, you look good, if you had stitches or bleeding, kind of any questions, how that sort of is working out is usually done. There's also lactation support, can also come to your home. So I think the biggest thing is that you're not, or at least you shouldn't be, on the clock. So you're not working against the clock. There's not like this time constraint. There's not this protocol of like, we got to get this lady out of here because we got 2 other pregnant people who need to come into this room. Not all hospitals are like that, but there definitely are some that are like that. A lot of this stuff you can find out too by like Googling like local midwives and kind of seeing, and also talking to them as well, what kind of rhythm they like to practice in. So that was just like the pros. So some of the cons, I don't really like using that word, but I guess we'll just use it because we're just gonna, is some insurances don't cover home birth. Like they don't cover it at all, so you'd have to pay out of pocket. That's something I really can't tell you like how much that would be because it really depends on your midwife. So it's something you definitely would want to ask. Some midwives do take insurance and then some don't. It's kind of, you really have to research that. There is not an epidural machine that she drags with her. So one of the cons, I guess, would be is that you can't get an epidural. If you've never had an epidural, like I don't really know how you could compare that, but I guess that could be a con. But I feel like if you're going for a home birth, usually you're going because you don't want an epidural, so this could potentially be a positive. But it was in the con section, so I thought I'd mention it. I think a big con is just the risk factor that could happen. If you're a high-risk pregnancy, you could potentially have a high-risk birth that could potentially turn into an emergency birth. That being said, that can happen anywhere. It can happen, you could be planning to have a hospital birth and then be at your mother-in-law's and, you know, complication arise and you have to go to the hospital. So like it can really happen anywhere. The only like not positive, but I guess the good part is that you would be at the hospital, so things would be done really quick. Sometimes they're not though. So it's kind of hard. You sort of have to make that personal decision on what you're okay with. Let's talk about the pros of a hospital. Fetal monitoring and the IV, which goes here, sometimes there, sometimes here. Okay, no, it doesn't. So like you constantly know everything that the baby's doing, even though you kind of don't. But you have that option of fetal monitoring if that's gonna make you feel better. And that could be, you know, somebody's like defining factor of being like, yes, you know, I want the fetal monitoring. Depending on your insurance, the hospital birth can be like completely free. Usually, I want to say it's not. Usually you have to pay something out of pocket, but most of the time, like pretty much a good percent of it is paid, which can be another big factor for people, and that's fine. You're also still able to have a completely natural birth in the hospital. And that's definitely something to put in your birth plan or to talk about with your OB. And the nurses and everybody who's kind of on your support team, you can still have that natural birth in a hospital. And a lot of people try and do that. A lot of people go in there because they're like, yep, the hospital, in case there's a complication, we'll be fine because we'll be in the hospital. But I'm gonna try, you know, all natural, which means no medications, you know, no interventions, no epidural, there's none of that, no Pitocin, no breaking your water, that type of stuff. Another kind of pro that people can feel more comfortable with is that there's more nurses there, there's kind of more doctors, they get this feeling of protection because they're in the hospital, and they feel, you know, that doctorly thing kind of come over them, and that helps them relax, and they like that the nurses could be there to take the baby to the nursery if needed. Also, some of the hospitals definitely around here have nurse midwives that actually work there, so that kind of ties in with you can have a natural birth in a hospital. So there's that lovely part about the hospitals that they do have midwives there. They do still have to abide by the hospital protocol and rules, but that's definitely something to look into. I think it's great that you could kind of have both. Another thing that can help people who are just really nervous about breastfeeding is that usually at most hospitals, there's a lactation consultant on site. So like baby's born, everything's fine, you know, that consultant comes right in and helps you right away. Well, you'd still have that at a home birth. The midwife could definitely do that, but if you feel that you need kind of like that person who has who has that knowledge of full lactation, they could be there in an instant, whereas at a home birth, they could probably come the next day. So there'd just be sort of like the time restraint there. The hospital also provides formula for the baby during your stay. So if you're not going to breastfeed, the formula is there. Obviously, after you leave, you know, you have to get it yourself. If complications do arise, doctors and nurses are prepared for that, and rooms are ready and waiting in case that happens. So a lot of this is really personal preference and research and asking questions and seeing which one of these like fits you best. So some of the cons of a hospital is that there definitely is limitations on drinking and eating. If you have a complication and you need to go into surgery and you need anesthesia that you could, you know, vomit, and there would be this big issue here, and there's kind of a lot of controversy with it. But there definitely is, at a lot of hospitals, there's some limitation on eating and drinking. Hospitals have a time limit, so a lot of times you can be working against the clock. I've definitely been in hospitals where that kind of feeling isn't there, but I've definitely been in them when it is, and I wasn't delivering, and I even felt like, whoa. It can definitely be scary for people, and it definitely makes them feel like, oh my God, I need to do this now, when, you know, they might not be ready. Baby might not be ready. Their body might not be ready. The hospitals, some hospitals can have really high C-section rates. This is something that you need to ask. Definitely ask the hospital when you go and meet your OB what their C-section rate is. Definitely something you want to ask, because if it's high, you could potentially have a C-section. So, you know, that's something to kind of look out for, because I know a lot of people are very nervous about that. Not all hospitals allow water births. That's kind of something, I know there are a good amount of hospitals where I live that do allow it, but you have to get out when it's time to push. So this is another thing that you should definitely ask. So this kind of goes with what I said about the clock, sort of, is that hospitals have this protocol, these procedures that they have to follow. So if you're not, you know, on that line of like progressing in a certain amount of time for them, and that can be stressful for everybody involved, not just you, like your husband or partner. That doesn't happen all the time. That doesn't happen in every hospital, but it's definitely something to ask and kind of figure out what their procedures are. You know, and ask your OB, what would happen if I wasn't progressing? How long would you let me? Having a doula will also really help kind of that streamline of like progression. Like if the doula's there, she can definitely help kind of, you know, be like, let's wait a little bit. Let's give her another 10 minutes and see if she dilates a little bit more. Definitely check into that. Also, I really do want to make a video about doulas. I haven't really gotten too many questions about them, but if anybody else is interested in like what a doula is, what a doula does, like how to spell doula, leave a comment down below and I'll definitely make that video. Something to kind of leave with is it really doesn't matter where you give birth. It doesn't matter how you give birth. All that matters is that you feel that you had the best birth possible. Sorry, the dog started barking, so I had to get up and get him. I really want to stress is just ask a ton of questions. Ask your midwife a ton of questions, ask your hospital, your OB, nurses, ask people who delivered with this nurse, with this hospital, like just overload them with questions, because if you just kind of go, oh, you know, everybody picked that one, your likelihood of having that beautiful special birth that you want is pretty low, because you kind of have to do it like meet it halfway. So you gotta like ask all these questions, do all this research, and then you're this much closer to like having that birth. Obviously you can't, you know, make it happen, but if you try to find that OB who's really going to give you that time to push that baby out, or if you find that midwife who's going to do the same, you have a higher chance of having that special birth that you want. So I think that completes this video. Thank you so much for watching, and please give me a like and subscribe if you haven't already, and I will see you guys in my next video. Bye. Whoops. Hey guys, I'm here. Okay. Definitely been times where I'm like, ooh, that would have been nice. But I didn't want one, nor did I have enough time to have one. Anyways. Sit down. Okay. Where I left off because the dog started barking.